One of the commonest questions I get asked is it safe to combine two different procedures? A really common one is the mummy makeover, which usually involves a tummy tuck, although it could just be liposuction, plus either a breast augmentation, sometimes a breast augmentation and lift, sometimes it's a breast augmentation and lift, so different combinations with the breast and the abdomen, sometimes including the flanks. So the answer is it's extremely safe, but there are some extra additional risks. So the biggest risk is that, of course, it's prolonging the time of your operation. Whenever you're put to sleep in a major surgery center, we all put pneumatic stockings, which are basically stockings that will pump your legs and your calves, and that does a lot to decrease the risk of blood clots. The other thing that I do with almost, if not all of my patients, any procedure that goes over 3 hours length of time, I put you on something called Lovenox. So it's a little needle that either you or your partner will usually inject into your thigh. And what it does, it's like heparin, it decreases your risk of getting blood clots. It doesn't make it zero, but it significantly decreases that risk. The third thing that I do is I have my patients up walking really quickly. Same day, same night, next day. I have you shower the next day. So I try and get you moving right away, and those really decrease the risk. It doesn't completely eliminate it, so there is a greater risk for a 4.5 or a 5 hour operation than a 2.5 hour operation, but it's not a huge increased risk. There's always a little bit slower recovery when you essentially have surgery on an abdominal area and the breast area, because you're getting different signals from two parts of your body. However, the recovery isn't that much longer, so for a lot of people, it's a lot more efficient. Plus, they just like the idea of getting over and done with rather than having to come back. And it usually saves them a moderate amount of money because they're not going to the operating room twice. So there's definitely advantages to combining procedures, and overall the risks aren't really much greater, but they are slightly greater, and that's something that has to be individualized, and I would discuss with each person on an individual basis.